Welcome to Lesson 3 of the KS Medical Coding Academy course. In today's session, we will explore anatomy and physiology, the foundation of all accurate medical coding. Understanding how the human body is structured, how each system functions, and how diseases affect these systems will significantly improve your ICD, CPT, and HCPCS coding accuracy. Why coders must know anatomy? As medical coders, our job is not only to assign codes but to understand the story behind every diagnosis and every procedure. Anatomy helps us understand where a disease occurs. Physiology helps us understand how it affects the body. When coders understand anatomy, they code with confidence, accuracy, and speed, and they reduce claim denials. Anatomy versus physiology. Anatomy focuses on the structure of the human body, the bones, organs, tissues, and cells. Physiology focuses on how these structures function. Together, they give a complete picture that is essential for accurate medical documentation and coding. Levels of body organization. The human body is organized in a series of levels: chemicals, cells, tissues, organs, organ systems, and the complete body. Coders frequently encounter diseases or procedures that target a specific tissue, organ, or system. Understanding this hierarchy helps decode complex clinical notes. Skeletal system. Slide 5 functions. The skeletal system forms the framework of the body. It supports movement, protects vital organs, stores minerals, and produces blood cells. This system is central to many ICD-10 fracture and orthopedic codes. Axial and appendicular skeleton. The axial skeleton includes the skull, spine, and rib cage. The appendicular skeleton includes the arms, legs, pelvis, and shoulders. As a coder, you must recognize these regions because fracture codes require precise location. Key bones. Commonly coded bones include the clavicle, humerus, radius, ulna, femur, tibia, fibula, and the vertebrae from cervical to lumbar. Each bone has multiple segments, and ICD-10 requires accurate anatomic specificity. Common diagnoses. You will frequently code conditions such as fractures, osteoarthritis, osteoporosis, scoliosis, and disc herniation. Each condition has specific coding rules that rely heavily on anatomical terminology. Coding tip. Remember that fracture coding requires laterality, encounter type, and fracture pattern: closed, open, displaced, or non-displaced. Missing these details can lead to claim denials. Muscular system. Types of muscles. The muscular system includes skeletal muscles for voluntary movement, smooth muscles found in organs, and cardiac muscles found only in the heart. Muscle injuries often appear in emergency documentation. Common diagnoses. You will encounter diagnoses like muscle strains, myositis, myopathy, and rhabdomyolysis. These require coders to understand the specific muscle group or region affected. Coding tip. Muscle injuries often require external cause codes. For example, was the injury due to a fall, sports activity, or accident? These details matter. Cardiovascular system. Components. The cardiovascular system includes the heart, arteries, veins, and blood. It circulates oxygen and nutrients throughout the body. Heart anatomy. The heart has 4 chambers: right atrium, right ventricle, left atrium, and left ventricle. It also contains 4 major valves. Coding cardiac conditions requires understanding coronary arteries and conduction nodes. Functions. This system maintains blood pressure, delivers oxygen, and removes carbon dioxide. Any disruption can lead to life-threatening conditions. Common diagnoses. Hypertension, myocardial infarction, heart failure, atrial fibrillation, and coronary artery disease are some of the most coded cardiovascular conditions. Each requires careful selection of specific ICD-10 codes. Coding tip. Myocardial infarction codes must specify whether the MI is initial or subsequent, as well as the location and type, STEMI or NSTEMI. Respiratory system. SL. Major organs. The respiratory system includes the nose, throat, trachea, bronchi, and lungs. The key functional units are the alveoli, where gas exchange occurs. Function. Its main function is to supply the blood with oxygen and remove carbon dioxide. Common diagnoses. Asthma, pneumonia, COPD, bronchitis, and pulmonary embolism are seen regularly in outpatient and inpatient encounters. Coding tip. Pneumonia coding requires the organism causing the infection. Coders must check whether the documentation mentions bacterial, viral, aspiration, or unspecified pneumonia. Digestive system. Components. The digestive system starts at the mouth and ends at the rectum. It includes the esophagus, stomach, intestines, liver, gallbladder, and pancreas. Functions. It is responsible for digestion, nutrient absorption, and waste elimination. Disorders here affect millions of patients worldwide. Common diagnoses. Frequent diagnoses include gastritis, hepatitis, pancreatitis, GERD, and appendicitis. Coders must pay attention to whether the condition is acute, chronic, or specified by etiology. Coding tip. Liver and pancreas conditions often depend on the cause: viral, alcoholic, hereditary, or medication-induced. Always verify these details in documentation. Nervous system. Components. The nervous system includes the brain, spinal cord, and peripheral nerves. It controls all bodily functions and responses. Functions. The system is responsible for sensation, movement, memory, and coordination. Damage here affects the entire body. Common diagnoses. You will frequently code conditions such as stroke, seizures, paralysis, neuropathy, Parkinson's disease, and dementia. Coding tip. Stroke coding requires details: ischemic or hemorrhagic, artery involved, and any residual deficits. Always check the neurologist's notes. Endocrine system. Major glands. The endocrine system includes the thyroid, pancreas, adrenal glands, pituitary gland, and reproductive glands. These regulate hormones. Functions. Hormones control metabolism, growth, reproduction, and many automatic body functions. Common diagnoses. Diabetes, thyroid disorders such as hyperthyroidism, adrenal disorders, and PCOS are commonly coded endocrine conditions. Urinary system. Components. The urinary system consists of the kidneys, ureters, bladder, and urethra. It removes waste products from the body and maintains fluid balance. Common diagnoses. Common conditions include urinary tract infections, kidney stones, renal failure, and incontinence. Reproductive system. Male components. Key male organs include the testes, prostate, and vas deferens. Female components. Key female organs include the ovaries, fallopian tubes, uterus, cervix, and vagina. Common diagnoses. Common conditions include PCOS, fibroids, infertility, and prostate hypertrophy. Integumentary system. Components. The integumentary system includes the skin, hair, and nails, the body's first line of defense. Common diagnoses. Cellulitis, dermatitis, burns, lacerations, and skin infections frequently appear in emergency coding. Lymphatic and immune system. Functions. This system manages immunity, protects against infections, and helps maintain fluid balance. Common diagnoses. Common diagnoses include lymphoma, lymphedema, autoimmune disorders, and immunodeficiencies. In this lesson, you learned the structure and function of all major body systems. This foundation will help you accurately understand diagnoses, procedure documentation, and coding logic. Strong knowledge of anatomy improves decision-making, reduces coding errors, and enhances your confidence as a future medical coder.